Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from Boise, Idaho, and loving the beautiful weather, loving the long, late nights. It doesn't get dark here till 10 o'clock at night this time of year, so it's really, really cool. And we're super excited to be here and super excited to be streaming our podcast, our midweek podcast, and super excited to have Jana Pedersen on our podcast today. I've known Jana for, probably 4 or 5 years now, and she specializes in functional medicine, and she is going to tell us a little bit about her story. So Jana, welcome to our show.
Good morning. Great to be here. Thanks for having me on. I'm Jana. I'm a nurse practitioner. I have been working in primary care, pediatrics, adults for several years, and then doing some integrative care too. I graduated from Gonzaga and then did some other learning in the integrative functional medicine world, and I'm happy to be here.
Awesome. So tell us what you do now and what kind of gravitated you towards integrative medicine. Well, actually, let's just define what integrative medicine is first for those of our listeners and viewers that don't know.
So integrative medicine, in my perspective, takes the best of both worlds, and it combines some of the traditional aspects of care and then some of the what we consider alternative aspects of care. And that might be using some herbs and supplements. It might be chiropractic, massage, acupuncture, those types of things in order to achieve healing and relief from symptoms.
Now, tell us a little bit about your background further back. Before you were a nurse practitioner, what were you doing?
So before I was a nurse practitioner, I was an RN at Sacred Heart in the pediatric oncology unit. I worked there for about 10 years, and with the goal of always wanting to be a nurse practitioner. That was my end goal always when I started nursing school. And I worked for a couple of years in primary care and just felt a little bit frustrated with the options that I had to offer people. I felt like people were coming in and not finding relief with medications that I was providing them, prescribing them, and I felt like I needed to dig a little bit deeper and find some other resources to help people really find healing. And that's where integrative functional medicine comes in, because it allows me to use a broader scope of tools to help people and look at things from a little bit of a different angle. Functional medicine looks at people from a whole perspective, everything that makes up that person from birth to that moment in time, environmental exposures, the food that they eat, the lifestyle that they're living, medications they've taken in the past, genetics, takes in all those factors and looks at them at that moment in time and what might be the influence in their health then. So it really gives a bigger picture of that person. Tends to take a little bit longer. So I am not working in primary care with adults. I'm doing a little bit with pediatrics, and then I have my own functional medicine clinic, Grow and Flow Wellness, with a couple of co-founders, doing some functional medicine, personal training, and health coaching.
Awesome. So didn't you, before you were a nurse, weren't you a personal trainer?
Yes. Yeah. I did some personal training at a place that no longer exists called the Ladies Club. and
isn't that what you went to school for? Is that correct?
Yeah, I have my first bachelor's is in exercise and sport science.
Yeah. I remember that now. So
yeah.
I mean, which, what a great way to train. And I'm sure that's part of the reason you like integrative medicine and functional medicine is because of that background, because that's so important when it comes to our overall general health.
Right. Yeah. And also I'm really excited that we have personal training, because I feel like exercise movement is so important to health. Like muscle is medicine. It's a necessity, especially as we start to get older, that we need good strength to maintain good health.
Jan and I talk about it all the time, that really 3 things that we need. I mean, there's many things we need as we get older, but when you look at people that get older and look old and feel old and start falling down, they lose strength, they lose balance, they lose mobility. So
Right.
If
Right.
you can all three of those things, I mean, just think about it. You're going to be able to walk. You're going to be able to be ambulatory. You're going to be able to stand. You're going to be able to not fall. And that's why it's just so important to work on those things.
Exactly. And then there's also the mental aspect because physical activity has been shown to affect our mental faculties too. So you're able to think cognitively for a longer period of time, which is something that's important to me.
Well, we say it all the time on our podcast that there is no better antidepressant than exercise.
For sure.
And I truly believe that. Janet,
Yeah.
what questions do you have for Jana?
So, Jana, a lot of times people aren't expecting what you're offering. I mean, I think more people are asking for it, but they don't know what they're going to walk into because we've been kind of conditioned to what it would be normally like to go see our nurse practitioner or a doctor in a clinic. So kind of describe what that feels like and looks like for them, because if you haven't experienced that, you're kind of in the unknown. Like, what are they going to do? How's this going to look? What's an
Sure.
appointment?
Sure.
Going to feel like?
That is a really great question. So functional medicine takes a little bit longer. So it's not a quick 10-minute visit like when you go to see your primary care provider. It is when people make an appointment with me, I send them a long questionnaire that just takes everything into account as far as their health history. So it health history from birth to that present time. And fill that out. I go through that before I meet with them. I take notes so that I have a good idea of their concerns and the questions that I might need to ask. And then when they do meet with me, it's usually about an hour, the very first visit. And we go through the health questionnaire. We talk in detail about their questions and concerns, and then come up with a game plan and what do we need to do? Are there any extra tests that we need to do? Are there diet lifestyle changes they need to make, those kind of things. So it's a little bit different. It requires a lot more investment from the patient because it's more work. It's more than just here, take this pill and I'll see you when you don't feel good again. It's an investment of time and effort, money too, because usually there's some testing and maybe some supplements involved that insurance doesn't cover if people are using insurance.
So tell us, the title of our podcast is Choosing the Right Healthcare Provider. So tell us how a patient can do that. What's important in those steps?
I think that's so important in today's world. I hear horror stories all the time from patients about just unfortunate experiences that they had with a provider. And so I think it's important for people to remember that they have a choice. They don't have to see that one person if it's not a good fit. And there's a couple of things that we'll go through that can help people find the right provider. The first thing that I recommend is like know what you're looking for. What is it that you want out of that experience? What is your biggest concern? What do you want them to address? And what do you expect? Knowing that can help you guide you to the right provider. And by provider, I might mean an MD, a DO, a nurse practitioner, a PA. It could also be a chiropractor, massage therapist, an acupuncturist, Chinese medicine, any of those things. I encourage people to think outside of the box as far as providers, because sometimes what we're looking for isn't always found in one person. Sometimes it takes more than one.
Yeah, that is true. So what would you suggest? How would somebody go through that process of, is there like what specific questions should they be asking?
I think first of all, after they ask themselves, "What am I looking for?" Then finding, looking at all your resources, searching online, asking friends, um, what are the providers that I have as an option, and then looking at their credentials. What kind of credentials do they have? Are they certified or are they licensed in the area that you're looking for? Do they have because then you know that they've gotten the education and they're going to be able to give you correct information. After that, I recommend people um, besides knowing your goal is, I look at my notes and I don't forget. Does a provider have experience? And is that provider, if something that you want, is that provider willing to work with other providers? For example, if you have a cancer diagnosis and you want to add in some integrative options, are the providers willing to work together? Are they willing to do provider to provider consults? Are they willing to help you get to where you need to be? And I think patients, I think our traditional healthcare has kind of trained the general public to just accept what a provider has to offer and kind of take it at face value and not question. And I'm not saying people have to question everything, but I think that we need to learn to be really good advocates for ourselves. In the real world, most providers don't talk to each other. They don't collaborate. If you have a nephrologist and a cardiologist, they're not going to talk to each other about that particular patient. They're in their own little silos, and it's up to the provider to it's up to the patient, excuse me, to be an advocate for themselves and to make sure that there's a connection there. Unfortunately, it would be great if we had more connection. So that's something that could be important to ask of a provider is, are you willing to collaborate with another provider? Because this is what I would ask for. I think if we ask, we're more likely, as a patient, we're more likely to get that option. Sometimes it takes some pushing and being a good advocate for ourselves.
I think that's an important one. I'm glad you brought it up because I don't think patients realize how little communication there is between providers. And unfortunately, a lot of times the patient has to be the one relaying all the information to, to the specialist or to the other provider. And it really shouldn't be that way, but it is. And a lot of times too, I like what you say, because sometimes there's providers that are like, this is, you've got one option and this is it. So if you want to do something else, you just, I'm not going to help you with that. And
Right.
That's unfortunate too. So and I'm sure you bring this up because you've seen this happen with patients and how unfortunate it is.
Unfortunately, yeah. And if you take the time to interview a provider, if that means talking to them on the phone, if you can get them on the phone, or having a visit with them and talking to them about, these are my needs, these are the things I want, take a list of papers, a list of things that you feel like you need, and go through them if you have questions and interview them. And I think that's a little bit of a twist that a lot of people don't think of, but have some expectations of that provider and let them know, these are my expectations. Are these something that you can meet? I'm sure there's lots of providers that are rolling their eyes at me right now. But
Well, if a patient doesn't have autonomy, I can share at least from the pharmaceutical side, what ends up happening is if that prescription's written and the patient's not bought in, they just don't fill it, or they fill it once and they don't take it.
Right.
So that honest and open communication is broken, right? Because the provider assumes you're doing something and the patient doesn't want to and doesn't want to buy into that therapy. So the goal is lost, right?
Exactly.
And I've seen that over and over and over in time. And, sometimes, I will just politely say, probably after a few times, that I think you need to have a conversation, right? Like, I'm not forcing you to take your medications. I'm not telling you have to, but I think you have to have a conversation, because in a lot of ways, if you say you're going to accomplish a goal a certain way and you're not bought in, then it's a waste of time of you and your provider. And, this isn't going anywhere.
Exactly. Yeah, that is a really good point, Janet. Yeah, if that's not something that you want, make sure you speak up. If it's something that has a side effect and it doesn't work for you, make sure you speak up. Yeah, providers oftentimes have kind of a set way of doing things because that's what they learned, that's what their experience is. So this is what I always do. And if that doesn't work for you, that's okay. It's okay to speak up. So I think we need to do a better job as patients with speaking up about what our needs are and how things are working, even if it might take a little extra time and effort.
Well, and hopefully you have a provider, or if you don't, then you need to find one that is open-minded to that stuff. Because ultimately the patient should be in charge, and if something's not working, the provider should be willing to work with him and
Right.
educate him why why this option or why a different option may not work. So, ultimately you can find a provider that's willing to work with you like that.
Exactly. And that's where interview some people, see who works for you. It needs to be a good fit, just like a dance partner, a partner. Like, it needs to be a good fit. It needs to be somebody that you feel like you can communicate openly with, that you can tell them your needs. They understand you, you understand them. They're not talking over your head and medicalese, that kind
Yeah.
of stuff. And I think it's also important, I kind of hesitate to bring it up, but I think it's important for people to do some research. If you've got a particular condition and you feel like your needs aren't being met, then do a little research and look for options. Be careful where you get your information. Like, just Facebook, Instagram is not a good place to get information. But if you
Yeah.
can find clinical studies, the internet makes all that so accessible today. Those types of things, if you can find articles written by professionals that know what they're talking about, and do some research so that you can, have proof. Maybe there's something that your provider doesn't know about. Maybe there's something that might work for you that they haven't prescribed.
So in some of these situations, I'm assuming that, one of the reasons we're discussing this is because you've had a situation where, the relationship with the patient and a provider didn't work out so well. And then maybe this patient found you and you were able to, make a difference in their life. So can you share a story like that?
I have lots of them. We'll start with
I
one and
figured you did.
try to be neutral. Yeah, I think that the one that stands out the most is I had a middle-aged woman come say having some menopausal symptoms, and her provider wasn't familiar with HRT and didn't believe it was a good thing, and so did not offer her anything. Essentially just said, "This is menopause, you just have to live with it. This is just how it is. Sorry." And left her to go on her way, and really kind of dismissed her and talked down to her, and she just did not feel seen or heard at all, and got no resolution for her symptoms, no options at all offered. That one, I think, is a big one. I think I've noticed more social media is coming up as a topic that women are saying, like, this is not being addressed and that's not okay. Yeah, so that's a good example of one where people have symptoms and they're just not offered any options. Or the other one might be that there's uh, a patient comes in with, like, well, I've done the research, I've Googled this, and that immediately to a lot of providers is like a red flag, where they're like, well, I'm the doctor, I'm the nurse practitioner, I'm the PA, and I've been to school, I know this, and so that's not right. I'm not going to listen to your options.
And I personally, I don't know about you, Jana, but I personally, and I'm going to speak for Janet and just say but I like educated patients. The more information they have, whether it's bad or good information, and probably if they did enough research, there's a little bit of bad and maybe hopefully a lot of good. But I like educated patients because then they're just easier to talk to about their condition. And it also means that they've done research and they're vested in their condition and probably want to get better.
Yeah, exactly. I totally agree. Yeah, I like educated patients as long as they're willing to be open-minded about, let's look for a good source. Instagram might not be the best place, but let's see if we can find some facts to back that information up and find some symptoms for you. I think that's a little where integrative medicine, functional medicine really shines, is that we're willing to really dig deep and find reasons. So I oftentimes meet with patients and then I'll go home and I'll do some research and try to find what might be the cause of some of your symptoms. This is not something I've encountered before. So I'm going to ask some colleagues and present a case study. I'm going to do some research and figure out what might be the problem. So take a little more time to try to really find answers for people.
I think we're talking about this a little bit because perhaps our experience was when we first went to school, at least maybe Shawn and I, and I'm hoping you did as well, that there were such things as round tables and case studies that physicians and practitioners would talk together about what they saw or what was happening amongst each other. So I think these relationships have become fragmented over time. But if you speak to, like, we've had some MDs that we've been talking to that, they're maybe a generation older than us, they did that constantly. They were not afraid to say, hey, this is not sitting well with me. I'm uncomfortable. Have you seen this before? Can you speak to that a little bit?
Yeah, that's an excellent point. That's not something I've experienced personally. I mean, as far as like in the past, um, not in a primary care type setting, but I think it's something that should happen because we can definitely learn from each other. We see different types of patients at the different places that I've worked in. I've seen different types of patients, and asking for help and learning from others is just invaluable. So it's something that I think we should do more often. I also think that because of our current healthcare model with insurance and time-based visits, that we don't have the time. And then all the charting, like we get burned out and yeah. So I think that's part of it, but definitely something that's I've sought out because I have learned so much from others. I have a couple of mentorship groups that if I have questions, I can ask them. And I learn so much from other people who see different presentations and have different experiences.
Well, I mean, that's really, when you think about it, I mean, that's how information gets spread, because chances are, if we've seen something, we might think it's unique, and it probably is to us. It might be to us, but somebody else has probably seen it. So why not
Right.
work with somebody else and communicate with somebody else that has seen it before and had success treating it?
Right, right, yeah, and I think that just kinda brings us back around to being a good advocate for yourself and finding that provider that's going to work for you, that's willing to put in the work to help you get what you need, and integrative medicine, functional medicine really does a good job of that, looking at the deeper root cause of what might be going on, exploring different options. Yeah.
So, do you have a favorite part of integrative medicine? We mentioned HRT, but there's so many other things. What's the favorite thing that you like to treat?
Mm, Probably gut health is probably my favorite because
Yeah,
our modern diet and lifestyle is just does not work with our bodies. Like our diet for the most part is pretty awful. I ask people about their diet all the time, and a lot of people will be like, I eat really well. And
yeah,
then I'll give an example of what they eat. And like they had some cereal for breakfast, they had a sandwich for lunch, and they had some meat and potatoes for dinner. And then I'll say, well, where's the vegetables? And they're like, oh, I eat vegetables sometimes. Or yeah, or they're having a protein shake for breakfast. And I think that's great because it's protein. And our modern diet advertising has gotten to us and is not very good. So that's one of my favorite things is I can really educate people about what's a good diet, how what's going to work for you. Not everybody needs the same diet. Um, and we can do a little experimentation. I usually start people with an elimination diet, just like let's pare back to the bare minimum and let's experiment. This is an N of one, and what is going to be right for you. Really pay
yeah.
attention to any symptoms, and then let's slowly add things back in and see how you feel. And that I think is important because I mean, I feel like I eat well because I have the knowledge, but there's still so much room for improvement. There's just so many things available. There's so much available. Like, when in the history of the world have we been able to go to any store and have millions of items available to
Right,
buy? Yeah.
right.
So,
And that, I mean, that may be good, but it may not be good. I mean,
right.
and going back to the cereal thing, I will tell you, I think it's getting better. I don't know, maybe not. Maybe it's just because my mind knows that it's out there. But, you know, I mean, I was raised in a generation to say that those breakfast cereals were good for you.
Oh,
Back,
sure.
35, 40 years ago, it was like, oh, breakfast is the most important meal of the day. And, started off with Kellogg's cereal. I mean, so there's probably still people buying that. So yeah, no, I
Oh, for
eat
sure.
well. I had, XYZ cereal for breakfast.
Right. Or
Um,
Carnation instant breakfast. like it's got all your nutrients in it, right?
Yeah.
It's full of corn syrup and sugar, but
Yeah.
it's got vitamins, so it's great, right? So yeah.
Or like you say, the breakfast smoothie, or just smoothies in general. And I'm not picking on them being completely bad, but I know I was counseling a gal one time, and she was trying to lose weight. So I'm going through, well, what do you usually eat? Well, I eat really well. Start my morning off with a smoothie, and I'm going to be embellishing this because I don't remember the exact details. Well, what's in your smoothie? Well, I got all healthy stuff in my smoothie. I've got a scoop of whey protein to get my protein in. I've got some orange juice in there. I've got some yogurt in there. I've got a banana in there. I've got some apple in there. And I'm like, you've got 600 calories in this smoothie. I
Right,
mean, for
and
breakfast, and you're
50
drinking it.
grams of carbs.
Right,
Yeah,
right.
yeah,
I mean, but all that stuff was healthy. And it's like, and here's one of the problems I have with smoothies is that if you put all that stuff that's in that smoothie and you tried to eat that separately, you probably couldn't. But it's easy to
right,
drink. It's
yeah.
so easy to drink your calories.
It's a good point. That's something that I often do with patients is I'll have them use a continuous glucose monitor for at least a couple of weeks and learn how is their body responding to those things like smoothies
Yeah.
or lack of sleep or stress or exercise. Just learn more about your body. That's when we have that option for people to give us good information. And I like data, and I think data is helpful to convince people too of, oh, I do need to make some changes.
Yeah. Yeah.
Instead of just me telling them what to do, having some hard facts is really helpful.
It is nice that continuous glucose monitors are so accessible now.
Yeah.
And they can be a good tool. I don't honestly, I don't know what your opinion is on them, long term for somebody, but I think some people rely on them too much. I think they're nice to have for a couple weeks or a month to say, oh, this is what a smoothie did. Oh, this is when I didn't sleep. This is what
Right.
happens when I exercised. But
Right.
then after that, you shouldn't be chasing your blood sugar. You should
No.
know, you know what I'm saying?
Right.
It's like, hey, no, I know that's bad. I shouldn't do that.
Yeah, yeah. No, if you don't have diabetes and you don't need a
Yeah,
continuous
right.
glucose monitor, I think it just can be a tool to help you understand how your body's working and the influences and what you're putting in your body. I mean, for example, when I started using a continuous glucose monitor, um and I would just use it intermittently. So I'd use it for a couple of weeks, make sure I was changing my habits, and then take it off for a little bit and then put it back on a month later. And like, did I keep those habits? How's my blood sugar? How am I
Yeah.
doing? But I would oftentimes be in a rush going to work, a little stressed out, trying to get there on time because I'm not a morning person and mornings are rough sometimes. And I would just grab like a handful of nuts and an apple as I drove to work. And I discovered that if I ate that apple first, it would really spike my blood sugar. And so that's healthy, right? It's a healthy food. But I learned that
Yeah.
if fruit by itself does not work well for my body, I need to have some protein or fat first. So information is powerful. Can
That's a
give us
very
the
good point. Yep.
yeah,
Yeah. And I don't think, I mean, how many people do that and they don't know what's going on with their blood sugar,
for sure. Yeah,
and then
yeah.
after they've, basically taxed their pancreas for 2 decades, then they have diabetes. And
Mhm.
if they would have
Or
known that
insulin
earlier,
resistance.
yeah, right,
Mhm.
Yeah,
right, right.
yeah, yeah,
Right. And it can be
exactly.
kind of, we had this conversation last night with a couple, when he can eat a certain way and she can eat a certain way, but it doesn't work out for both of them. And neither one of them looked unhealthy. It's not that, it's just that she was struggling a little bit. And I bet you hit on something that is probably true for her. It's how that food was, assimilated in her body, like how it started, where that should be. And you pointed out, and I think for women, this might be true, but it could be for men too, that, that protein first helped you bring in your fruits, right?
Yeah, right,
Without having
right,
an issue of it being irritating or spiking your sugar. So
right,
those tools are really cool that we have accessible to us because, you can play with it a little bit. You found out that if I eat my protein first, this isn't going to be a problem.
right. Yeah, exactly. Yeah, because we have so many options. We have so many things available. We just need the knowledge to how to take care of our bodies, and that's kind of trying to bring this back to how to choose a provider. That is something that you should have a provider that looks at everything, not just asks you about your diet and your lifestyle. That's an important part of your health. So that shouldn't be, we shouldn't be in silos. It shouldn't be just here, I take care of your GI tract, and I take care of your brain, and I take care of your heart.
Yeah.
We're all connected, and everything is working together. And so we need to consider everything all together. Um,
Well, and speaking of gut health, and probably one of the reasons that you like it so much is because it is so important. Um, you know, you said brain health, but without a healthy gut where you're absorbing your nutrients, you're not going to have a healthy brain. I
right,
mean, seriously.
right.
And Jen and I talk on our podcast all the time about there's really kind of three things that we can do to be healthy. And we've already talked about, we've already mentioned all of them, but sleep, exercise, and diet. And a lot of people will think, oh, well, gosh, look at that person. They're super healthy. They must exercise 4 hours a day. It's like, no, I mean, movement is very important, just like we talked about, but you can't overcome a bad diet by
Right,
exercise.
right,
So,
right.
your diet is super important. And even more important, you can eat as well as you want. You can exercise as well as good as you want. But if you're not sleeping, you will not be healthy.
Exactly. Yeah, I'm so glad that you brought that up, because those are simple things that people can do for free
Right.
to take care of themselves. Yeah, exactly. I was listening to a lecture just the other day. Jill Carnahan is an integrative doctor in Colorado, and listening to one of her lectures, and she was talking about how, because she's close to the Olympic Training Center there in Colorado, or in,
Durango. Is that
yeah,
Durango or
Durango
Colorado
or
Springs?
something. Yeah,
Durango,
so
Colorado Springs. Yeah.
she's saying that she treats a lot of those athletes, and that a lot of them have messed up GI tracts. They've messed up guts because they are exercising so intensely.
Yeah.
And so she tells them, I can't treat you until you're in the off season, because the amount of stress and you're putting on your body is just too much, and you can't heal in that kind of an environment. Yeah, so all those things are important, and things that we can do without the intervention of any provider, that we can do to take care of ourselves. And all those three things are so important and work together.
Yeah, well, unfortunately, I think there's just some lack of knowledge out there, and there's people that think that, and I think our healthcare system is guilty of it, because I think you'll agree, in general, our healthcare system doesn't talk about diet, exercise, and sleep. They talk about surgery and prescribing another medication, and you know, people want this magic answer about what can fix this, that, or the other. But like you say, they don't do the simple things first: diet,
Right.
exercise, and sleep. I
Yeah.
mean, you do those things first before, and get those things dialed in before you try any other biohack, because
Right.
those
Right.
things are a lot bigger than any kind of biohack that you can do.
Mhm, mhm. One example, I had a patient recently who had psoriasis, and that's, for me, I feel like skin is the palette of what's going on inside. And so he was contemplating biologics to treat the psoriasis, because it'd been a long-term thing since he was a child. And hopefully we can work on his gut. Verdict's still out, but we can work on that gut health and prevent him from spending $30,000 a year to take biologic medications that have other implications too.
Right. That's part of the
So
problem, not just the cost, but the side effects.
yeah, yeah. So that's one reason why I really like gut health, is I think that you can make some of those small, simple changes in your diet and your lifestyle, add a few healing supplements temporarily, and you can see big changes in acne, in your energy levels, how you
Right.
feel. If you've got already got GI issues going on, like resolution of those, it makes a big difference. Because if you think about it, our our bodies are like a big donut. It's kind of an odd concept, but our GI tract is really exposed to the outside world. It's the only way that we bring in outside items
You're
into
right.
our bodies. So they have a big influence, and for good or bad.
Yeah, if you don't have a healthy gut, you can't really have a healthy body. Those are just,
Yeah,
that's just physiology.
yeah,
Physiology.
yeah.
So as we wind this podcast up, Jana, tell us what you have a passion for.
I have a passion for helping people feel understood. Um, I think one of my skills is listening, which is a good and a bad thing sometimes, but is listening and just really listening to people's stories. And oftentimes the patient already has the answer. If you listen close enough,
Yeah.
you'll hear that they have the answer. So really listening to people's stories and, you know, letting them kind of direct, what do I need to do? Where do I need to go? And me using the tools and the education that I've gained to help guide them and direct them and kind of hold their hand as they walk down that path. Um, yeah, so I think that that's the biggest, most important thing is to help people understand that they are heard and they're seen, and then we're going to work together to find help.
Awesome. So I'm streaming your website here, Grow and Flow Wellness. And tell us a little bit about your website and how people can get a hold of you if they have a question.
So the easiest way to schedule an appointment or just to book an exploratory call is that button on the upper right-hand corner that says book a call. I think there's also one down in the footer that says book a call too. There's 15-minute free exploratory calls for personal training and for functional medicine. And then you can also book a visit there at your convenience.
I love it. So, Jana, thank you so much. Our goal is this podcast is to educate and empower individuals to take charge of their own health, and you have helped us realize that goal. So, thank you so much.
Excellent. Thank you so much for having me on, Shawn Janet. It was a great conversation.
Thank you. And
All right.
listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday to our regular scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you.